The speaker will be Professor Miri Sklair from Tel Aviv. You see her role, the Director of Breast Imaging in the Department of Diagnostic Imaging at Sheba Medical Center. So Miri, please.
Thank you, Luke. Thank you for the opportunity to present our initial experience with the automatic classification of lesions in contrast mammography using AI. So I again just briefly introduce our center and our experience with contrast mammography and the development of AI using contrast mammography. So again, I'm coming from Tel HaShomer near Tel Aviv, and it's the largest hospital in Israel. And this is the center I'm working in, and it's a one-stop center, multidisciplinary, and we are lucky to be multimodality. And I think that we are looking for almost 20% of the women with breast cancer diagnosed in Israel. So it's a large number of women, and again, a high number of BRCA high-risk breast clinic. And again, being multimodality, we have two mammography. One of them is the CSM and Pristina, doing around 800 in a year. And again, I also want to stress the importance of the MRI. We have them both. We have a 3T Siemens. It was replaced last year. And we are doing around 4,000 breast MRI a year. And we are very lucky to have it in our unit. And sometimes we really use it at the same day. It's not the place, but we are developing also the ultra-fast breast MRI, and it's possible to do breast MRI, a kind of a full protocol in 5 minutes, but it's not the issue of this session. And of course, we are doing large number of image-guided biopsies. Regarding our experience with contrast mammography, I think we're of the first users, and we are using it from 2012. And you can see that the numbers are increasing. And compared to what has been discussed here, most of our studies, we started with the clinical indication, diagnostic indications, such as evaluation of extent of disease, palpable lesions, but with gaining experience, we started to use it in a screening, as a screening examination. As you can see, most of our studies are screening. We have published our first experience at the year 2018. We looked at 600 cases, and the cancer detection rate of contrast mammography was double of that of the 2D mammography. So it supported our experience, and since then we are doing contrast mammography screening, and if it is normal, we are doing every 2 years screening with contrast mammography. And I just want to stress the easiness and the simplicity of performing this examination for the screening of women with dense breast. So just an example, this is a 52-year-old woman, and she had a previous digital mammography, and what we do, we ask her, are you willing, or we explain about the contrast mammography, and we ask her if she wants to do next year a contrast mammography study, and she said that yes, and this is a normal contrast mammography, it's a BI-RADS 1, and we don't have to add ultrasound. She can go, and the next study or the next screening is going to be in 2 years. And we are definitely sure, 100%, that we didn't miss breast cancer. Okay, so we started to develop AI as a support to our interpretation of contrast mammography, and it is patented and granted by different companies. And the initial research, we started it a few years ago, and it is together with the Tel Aviv University. All the data is annotated, and all the women in the study are after a biopsy. We have a gold standard biopsy result. A precise AI algorithm for contrast mammography was developed, and our purpose is to implement this development or this AI system in our workflow in Sheba. And why do we need a little bit just contrast mammography? And we saw following the talks today, but the main limitation of mammography is the breast density, and it appears in a quite large number of women, and that's why contrast mammography is very important. However, contrast mammography as breast MRI has limitations because it is a very sensitive examination, but it is still very difficult to distinguish between benign enhancement and malignant enhancement. And we also know that a large number, around 60 to 70% of our biopsies are benign biopsies. And we try to reduce this number, meaning to improve the specificity of the contrast mammography. And we know that benign lesions can enhance. It was described in the literature, and most of those are either fibroadenomas, papillomas, hyperplasia. Cystic lesions have the typical appearance like in breast MRI, rim enhancement, so those are very typical, and those are BI-RADS 2 lesions. So let's look at the literature, or what is the research that is done today looking at contrast mammography. So there are basically three directions. One of them is to distinguish between benign and malignant, and this is, for example, a study from Patel. They looked at 50 lesions, and AI with contrast mammography could diagnose accurately 45 of those lesions with an accuracy of 90%. Another direction is to distinguish between invasive and non-invasive breast cancer, and again, to perform molecular subtyping and tumor grading, similar to the AI research for breast MRI, and again, we can see some of the studies. And another important direction is to differentiate, again, benign and malignant, but also to differentiate lesions from BP, which is, I think, is an issue, as in breast MRI. It is the same in some of the patients in contrast mammography. And this is, for example, a 76-year-old woman. She is taking HRT for many years, although she has a family history from a sister, and we could not prevent it. So because she has dense breast, we suggested to perform contrast mammography, but we can see marked BPE. What we suggest to women that take hormone replacement therapy is to stop the therapy for 2-3 weeks, and then to perform the study to reduce the BPE. Okay, so let's see how our system is working, or what is the problem. Here, for example, we can see two cases. There is a small enhancing lesion on contrast mammography. Can we tell which is benign and which is malignant? Basically, I think it's very difficult, and we cannot. And this is, for example, we use the AI system, and this lesion is central posterior to the nipple. Here we can see the score that we receive in blue is the benign, and the score was a benign lesion, okay? And the other small lesion, the score is a malignant lesion, and it is compatible with a known pathology. Okay, so from our eyes, or when we look at the studies, it is really very difficult to say benign or malignant, but when we are using the AI system can detect whether it is benign or malignant and give us the score. So let's look at how is the system works. I'm not a computer specialist, so I will just review what we are doing, but basically we making an ROI of the lesion, and it is sent in a BI-RADS lexicon, and it is sent to a server, and the AI system calculates and presents for us the score. The data is based on 438 breast lesions in contrast mammography. We trained the system with 216 benign lesions and 139 malignant lesions. And the test, which is the test of the system, there were 50 benign and 33 malignant lesions. And this is how it works. We see a lesion, we mark the lesion. The system performs a segmentation and sends it to the server. And it is based on 200 features that the AI system takes into consideration and performs a classification. Basically, how we work, we mark the lesion, we send it to the server, and then we receive the score. And again, this is the system performs an AI 3 algorithm based on different features. And if we look at the ROC curve, we can see that the blue line is the average performance of the different algorithms, showing that basically there is no difference between the different algorithms, and it shows the stability of the system. And we get a decision of the system, and just let's see a few cases. So here again, contrast mammography study, we can see a large area of irregular enhancement. We mark, according to the Bio-Rad's lexicon, the BPE, the mass, the contour of the mass, the margins, and the heterogeneity, or whether it is heterogeneous or non-heterogeneous enhancement, and we send it to the system, and we immediately, after a few seconds, receive a score, and this was a malignant lesion. This is another case, and it takes a few seconds to fill the Bio-Rad's criteria and to send it to the system to receive a score. Here is another small lesion, and again, it's very difficult to say whether it's benign or malignant. So we fill the Bio-Rad's lexicon. There is a mild BPE, oval lesion, circumscribed, heterogeneous enhancement, and we send it to the system, and it was a benign lesion, and again, compatible with the ground truth pathology. And this is another lesion. Marked BPE, sometimes very difficult. But there is the contouring of the lesion, and again, a benign lesion. And looking at the 83 cases that the AI tested, we could save, or it was accurate in 40% of the benign lesions, meaning that 40% of our benign breast biopsies could be not performed or were unnecessary. And we kept in this study a sensitivity of 100%, meaning that the purpose, or we said to the AI system, our sensitivity is 100%. We do not want to miss any breast cancer. So this is the performance when using a sensitivity of 100%. Of course, we have limitations of the study. It's a retrospective research study and performed in a single center, and it should be validated in a larger data. And as we see it, the value of this AI system could be to support our decision whether to biopsy or not to biopsy, to reduce the number of the benign breast biopsies. Of course, the cost. We plan in the future to perform, that the system will perform automatic segmentation of the full contour of the lesion and not us as radiologists. Also in the future, automatic Bio-Rad's classification of the system, because it's sometimes very difficult to say whether it's a oval or a round lesion, so it can be done automatically. It is possible also to perform risk calculation based on the demographic or the questionnaire that the woman fills. And in the future, I think it's an interesting research, because we all say that there is no kinetics in contrast mammography, but it seems that there is. In this small white, there is a Chinese study that showed they did a qualitative assessment of the change in the kinetics during contrast mammography, because if you think we are doing a first, for example, RCC, and then the second right oblique is going to be after 4 minutes, so definitely there is a washout and wash-in of the lesions, and they show the correlation. If there is a wash-in, it's more compatible with a benign lesion, and if there is a washout, it's more suspicious for a malignant, and we definitely can see it, so this is a future research that we plan. And I would just like to thank